Sorry, the video stopped there. Part 2 of the message. What I want to say, today, if staff has been recruited from Colombo or Sri Lanka, or from Pune, India, or from Dhaka, or from Karachi, or from any part of Europe, even if he has worked for 1 year, he will get all the medical facilities in PDO. When I was in Rafa Hospital, there was one Indian guy who was being admitted in the hospital, okay, on the company account. Okay, I think this is very unfair, and the way PDO is treating pensioners and retirees now, it is not fair, it's not ethical. We need to speak out. We cannot remain quiet for long, because it is the living things to be on quiet is where injustice and unfairness come in. We understand the economy is bad, and the situation economically is bad, but at the same time, there is humanity, there is professionalism, there is ethics. Today, a Shell International staff, even if he has retired, he gets all from the facility. It is there in the PPM. Don't forget, I was in charge of transferring the PPM to Oman policies, and it is so I know all about PPM, expanded personal policy manual. Okay, medical treatment for Shell International staff, even for Western direct hires, is there. If you compare a retiree, a pensioner of Western direct hire, and Shell International staff and the Oman staff. Today, for example, a director who was sent to UK because he got brain hemorrhage, he will not get even a letter to go to do an X-ray or CT scan. I think this is too much. There has to be something. The Minister of His Excellency Minister of Oil, His Excellency Dr. Mohammed Rumi, was an ex-PDO staff. Assistant Under Secretary, His Excellency Salam Anofi, was PDO staff. So they know everything that was in PDO, and now they're in a position to change things. And His Majesty Sultanate bin Tariq Al Said, who is very knowledgeable of all the things that are happening in PDO. So we appeal, please look into our case. We cannot afford private hospitals. Government hospitals, there's a lot of waiting list. I went to both hospitals. I went to Hola Hospital, I went to Royal Hospital. I was admitted in hospital for only 1 day. Then the next day they had to release me because they're running shortage of beds. I think pensioners have to be looked after. A nation that does not respect its elders will never become prosperous or become, advanced or developed. If pensioners who are the elder people of the nations are ignored. This is my appeal to you. Please look into our case and our patient. Protect our patient, protect our medical treatment, please. Okay, thank you very much. Goodbye.